Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Welcome to a short video on the knee joint. So we talked before about the hip joint, and we said that it was a ball and socket synovial type joint. So the knee, which is the next joint in series, is also a synovial joint, right? Because all of our highly mobile joints are synovial. So this is good. So if you think about it, pretty much any joint in your body that moves must be synovial in its type because it is highly mobile. Now, we would also class this one then as a hinge joint, because just like a door, it can only open and shut. Now, there will be some extra detail with it. We know that the knee joint is slightly modified because it also has some aspects of rotation, but let's just take it as a hinge joint at this point in time. So to bend it and reduce the angle between the two segments we know is flexion, and to straighten it and increase the angle between the two segments is to extend it. All right, so flexion and extension are then the motions that would occur around the hip joint. Now, if we have a think about the muscles that we discussed in some previous videos, the muscles which would flex the knee would be your hamstrings, which were biceps femoris, semitendinosus, and semimembranosus. Now, if you also remember, these ones go right up to the pelvis and therefore also extend the hip. Now, if we can add a bit more detail to our hamstring muscles, we know that these muscles here are innervated by our sciatic nerve and make up our posterior thigh. Now, extension, muscles of extension, they're your quadriceps, all right, or your anterior thigh. So quadriceps femoris is the group name, all right, and individually, if we've got four of them, you will have rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. Now, all of these ones then are innervated by your femoral nerve. Okay, so they're knee extensors, but then the secondary function of rectus femoris, as an example, is to flex the hip along with those large hip flexors that we talked about, like iliopsoas and also sartorius. Now, on the model here, what we can see is this here would be representative of your quadriceps tendon. All right, so embedded within that is we have a bone. Now, this bone here is your patella. All right, and we will describe it as a sesamoid bone because it's embedded within a tendon. So what actually that helps allow to happen is the tendon of the quadriceps to pass beyond the knee, attaching here to the tibial tuberosity. So some people call this part a ligament because it goes from a bone to a bone, but you can also just call it the quadriceps tendon. So it allows that tendon to pass across the knee, and you can see that as I flex and extend the joint, that the patella would be articulating with this anterior surface of the femur here, right? And what that does is that stops the tendon wearing this part of the bone out over time. All right, so if we were to talk about a hinge joint and maybe draw it, all right, so you get a bit of better understanding. So you would have a stem, all right, which is the femur coming from above, all right, and that's going to go onto a structure which is running this way, all right. So you've got the femur which is lying there like that. All right, and then what we need to do is we need to put something around it so it fits. All right, so you would then have the tibia running like this, effectively. All right, so this is just a basic drawing of a hinge joint. All right, so that's going to run obviously through there, and then the lower stem like this. So you can see that it's going to be limited in the way that it can actually move, isn't it? So it can only tip backwards and only tip forwards. All right, so all hinge joints like your fingers or your elbow or your ankle and your knee, things like this, and your toes, they can only flex and only extend. So if we have a look at this, the knee joint in its flex position, all right, you've got only very small amounts of contact between the distal ends of the femur, which are these articular condyles, and the top of the tibia. So what we can see from there is that the most stable and most congruent position of the knee joint is in the extended position when there's more bony contact, and in flex position there's obviously less. Now if we talk about the ligaments around the knee joint and ligaments around all hinge joints, to be totally honest, is we're always going to have ligaments on either side like this supporting the joint. So when you have a hinge joint, ligaments either side, these ones are called collateral ligaments. So on the lateral aspect here, you would call this one the lateral collateral ligament, but because it also attaches to the head of the fibula, you would call it the fibular collateral. So you can choose. On this side then, you can probably guess medial collateral ligament, or because it's attaching to the tibia here, you might call it the tibial collateral ligament. Now, what you can do is you can describe these to, just in basically resist side to side forces that you can see here. So we'll do it from the back so we can see it a bit better. Right, so you can see that it would stop any spreading or side to side forces. Now, if a tackle was to come from the outside, and just like a bullet, it would blow up the inside because it comes through here and bang like this, you've got some tensile forces or stretch on the medial ligament when it's like that. So the tackles come from the outside and it's going to push like this. We can also describe this as a valgus type force. Right? Whereas if you tackle from the medial aspect and it was to push through this way, this would be described as a varus type force. All right? So at the same time, these ligaments also resist hyperextension and then some hyperflexion as well. All right? So they're pretty important ligaments on either side of the joint, but it's more likely to damage this one because tackles come from the inside more often than they come from the outside. What else is inside the knee joint stabilising it are these fibrocartilaginous discs that we have here. So you can see these C-shaped structures, these are the meniscus. All right, so you can see that they are taller towards the outside and then taper towards the inner aspect, so shaped like a wedge, and then from above they're shaped like a C. Now the reason why that is because the top of the tibia, if we have a look here, all right, is reasonably flat. So circular or rounded femoral condyles aren't going to fit into that too well. So imagine them like small cups that they're accepting and increasing the joint contact, so increasing that congruency again, all right? Now they're there also to reduce any focal stress, so if there was going to be a pinpoint stress on one point, it helps to spread that out and also to reduce the friction. All right. Now, your medial meniscus is actually attached to this ligament, the medial collateral, whereas you can see that there's a big old space here between the lateral one on this side. So any valgus type force or large injuries from the lateral aspect, which makes this occur, you can see that you might have damage of both things, the medial collateral ligament and the medial meniscus. Now, you're all wondering, can we get to the cruciate ligaments? So here, on the inside of the joint, you can see one coming forwards towards the camera and one going in the background away. So these are our cruciate meaning cross. So our anterior cruciate ligament is this one here, thin and cord-like, whereas the big thick one at the back here, running vertically in its orientation, not across, but vertically in its orientation, is the posterior cruciate ligament. Now, being the right knee, what we can do is if you cross your fingers like this, your middle finger represents the ACL coming forwards, and your index finger represents the posterior cruciate ligament going backwards. Now, what do they resist? Because if we've got the anterior cruciate ligament coming this way and posterior cruciate ligament coming this way, if I bring the tibia forwards, it's going to be the anterior cruciate ligament resist that. And if I take the tibia backwards, it's going to be the posterior cruciate ligament which is resisting that. All right. So which one's the more common one to damage? Is the anterior cruciate ligament. And right, this is generally in decelerating action. So when the knee is flexed, and you're trying to decelerate, and we might actually have some rotation, all right? So that rotation puts force, as you can see, as I'm twisting there, it's pulling on the ACL, all right? So decelerating, the tibia wants to continue to go forward, right? And it rotates like that, and what happens is the ACL will tear. Now, any really big injury where there's a tackle from the lateral aspect is also going to create this, right? So let's try and show how that's going to happen. So a big tackle from the lateral aspect. Normally what happens is you fall backwards, the tibia comes forwards, and you have internal rotation of the tibia. So the tibia would be rotating medially. So effectively what's going to happen is flexion here, internal rotation, and that's happening. Right, so what we can see is the ACL's on big stretch. The medial collateral ligament and the medial meniscus have been taken apart, all right, and they're going to be damaged too. So what can we call this as a complex, the three of them together, is we might call this the unhappy triad. So any question that you might find about the unhappy triad would be the combination of tearing of the anterior cruciate ligament, which resists anterior translation of the tibia, the medial meniscus, which is there to increase joint congruency, reduce friction, and to stabilise the knee joint, reducing any focal stress, and the medial collateral ligament, which is going to be resisting any valgus type forces. All right, so these three things together are the unhappy triad of the knee. Now, any tearing of this would result in knee surgery, all right, or total knee reconstruction, as you might have it know it. All right, thanks very much.